Every single time I visit one of our projects, I try to imagine what it's like to live in a place where there's disaster after disaster, where people's lives, their livelihood, their access to farmland, their homes, their equipment are washed away immediately, and they have to start all over again from scratch. On top of all of this, they need to deal with the stress of the long-term recovery, as well as the trauma of dealing with the loss of their loved ones. As all of you know, this is a situation that's common in too many places around the world. My name is Maya Kroitoru, and I work for the American Jewish Joint Distribution Committee. JDC, as it's known for short, works in the field of disaster response out of the conviction that the Jewish people have a responsibility to share their resources, their knowledge, and the experience to alleviate human suffering. We call it Tikkun Olam, which in Hebrew means repairing the world. And it is this value that drives us in our work across the globe, in the Philippines, in Indonesia, and in Nepal. And time again, we see the communities that we work with and the people living there utterly distraught. And that's why we aim to integrate psychosocial into our disaster risk reduction programs. So what is a resilient community? Perhaps at its most basic level, a resilient community is one that can bounce back quickly, that has the tools to overcome. But imagine what it's like to bounce back quickly in a situation where you don't have the emotional support to deal with the challenges of overcoming a disaster. Psychological resilience is key to effective disaster mitigation. Yet psychosocial is not given that much attention in the disaster risk reduction field. In addition, there's a lack of experts in many countries where disasters are prone. As a result, what we see is that in countries where disasters are the most common, most of the time, psychosocial is not properly addressed. That is why JDC integrates psychosocial into basic disaster response. So how do we do this, and why is it so important? I'm going to tell you through two stories. For the past 10 years, we've been working in Indonesia since the Indian Ocean tsunami. In 2015, USAID approached us, and we began a partnership to expand our program for psychosocial into an area called Mount Sinabung. How many of you are familiar with this region? It's in North Sumatra. It's a volcano that's been erupting since 2010 after 400 years of dormancy. And there's no clear end in sight. The volcanic eruptions are almost daily. The government recently expanded the immediate danger zone from 4 kilometers from the top of the mountain to 7 kilometers from the top of the mountain. When we were there in Indonesia on an assessment trip in Mount Sinabung, I met this woman. Her name is Nande. Nande informed me that her son Hassan went out together with other local farmers right after the most recent volcanic eruption to try to save lives as much as he could. He provided basic first aid and helped with the evacuations. Everything seemed fine afterwards, but about 3 months later, Nande informed me that her son Hassan started to exhibit signs of trauma. He didn't want to leave the house. He was depressed. He felt like he didn't do enough to save people the last time the volcano erupted. And he was also concerned about not being able to provide for his family in the way that he dreamed. This is his nightmare. This is Hassan. You see, these signs of trauma can stay with Hassan long after the recovery has completed, long after he's regained his crops, his livelihood, and his home. And this trauma can significantly hamper a recovery effort. The second story I'd like to tell you is from the Philippines. This woman, her name is Emily. She is a member of a Person with Disabilities Association that JDC helped establish in one of the islands that was impacted by the typhoon. Emily informed me that the program that we started for psychosocial and disaster risk reduction provided her with those tools that she needed in order to feel like she was supported, in order to vent to her family, so that they would understand what her needs are now and in the case of a disaster. But what perhaps was most important about Emily's reflection was the piece about timing. JDC started this program just as the emergency was beginning to conclude its emergency response efforts. Sorry, the community was beginning to include its emergency response efforts. They were exhausted, right? So this program provided them with an opportunity to come together as a community, to vent, to know that support was a key element of recovery. And that gave them that extra push, that extra amount of energy that they needed to get to that next phase of recovery. We brought our partners together in the Philippines last summer to talk about disaster response, disaster risk reduction, and psychosocial. What we call the new reality, the new norm following Typhoon Yolanda, known internationally as Haiyan. What was so beautiful about this experience was that the participants at the conference came and provided both their personal as well as their professional insights. And they really talked about the importance of this integrated approach, about bringing psychosocial into disaster risk reduction elements. And so I want to share and conclude with one of the quotes from one of the participants. Resilience starts within. Or as Rabbi Hillel said, if not now, when? Now is the time to start looking within, to begin to integrate not only the physical aspects of recovery, but also the emotional aspects of recovery, and to every aspect of disaster response and disaster risk reduction. Thank you very much.